common benign tumor of the uterus. It is mainly seen in nulliparous, obesity and hyperestrogenic conditions. Types. As we learned in the anatomy, the uterus is divided into the two parts, body and the cervix. Now, fibroid main three types you should know is what is intramural, what is subserosal and what is submucous. Let me explain you in a simple way. This is the figure, but let me explain you simple way. Suppose this is the uterus, this is the cavity, this is the fallopian tube. Now, if the fibroid is on outer side in the perimetrium, over the perimetrium like this, they are called subserosal fibroid. Subserosal fibroid. If the fibroid is in myometrium, are called intramural fibroids. If they protrude in the cavity, it is called submucous fibroid. So blue one is subserosal fibroid, green one is intramural fibroid and yellow one is submucous fibroid. So basically three types of fibroids are available: subserosal, intramural and submucous. Amongst that, this intramural are intramural is very common. 75% fibroids are intramural, 15% are subserosal and 5% are submucous. So basically fibroids are of three types. If you see many ultrasound findings, you see they are written as a subserosal fibroid, intramural fibroid and submucous. So this is how they differentiate what is subserosal, what is intramural and what is submucous fibroid. So it is the picture that shown here: subserosal, intramural or interstitial fibroid and submucous fibroid. The fibroid, sometimes the fibroid have the pedicle and they run, so it is called fibroid polyp-like structure. So pedicle is there and fibroid is hanging like a clock. So that is called fibroid polyp. Secondary changes. Sometimes fibroids remain in the 70% of the Indian ladies have fibroid, ऐसा बोला जाता है. But sometimes every fibroid cannot give rise to the symptoms. If it remains for a long time, in some cases it can lead to the secondary changes. So degeneration, hyaline degeneration is most common. And in pregnancy, certain fibroids undergo red degeneration. Degeneration यानी dissolution, ऐसे softening हो जाता है. It can be atrophy because fibroid is actually grow along with estrogen flow. तो जब तक menstruation आता है, जब तक estrogen provide होता है, फाइब्रोड फीड होता रहेगा, उसको न्यूट्रिशन मिलता रहेगा. दैट्स वाई इफ द फाइब्रोड प्री प्रेग्नेंट स्टेट में है तो प्रेगनेंसी में जैसे प्रेगनेंसी बढ़ेगी ऐसे फाइब्रोड भी बढ़ेगा, बिकॉज इट रिसीव्स मोर न्यूट्रिशन, मोर एस्ट्रोजन, प्रोजेस्टेरॉन. बट वंस द मेनोपॉजल स्टेट स्टार्ट, there is a decrease in hormonal availability, the fibroid can undergo atrophy also. Sometimes it leads to necrosis, sometimes infection can happen, and very rarely carcinogenic changes, that is the sarcomatous changes, can happen. How the fibroid patient present to you? 75% are asymptomatic. Site here in fibroid, site is more important than the size. The small submucous fibroid may give rise to the more symptoms than the big subserosal fibroid. The only headache is submucous fibroid, because in the cavity where the endometrium shed, means menstruation pattern, or when the baby grown, if fibroid is in the cavity, it give rise to the menorrhagia, or it can give rise to the infertility, it can lead to the recurrent pregnancy loss. So all the complications are happened with submucous fibroid. Subserosal and intramural doesn't give rise to the much more symptoms. Only in when it is of very big size, it leads to the compressional force. So site is more important than the size in case of the fibroid. So how they present? Mainly they are present with menorrhagia, metrorrhagia, dysmenorrhea, dyspareunia, means painful menstruation. If submucous leads to infertility, pressure symptoms, recurrent pregnancy losses. So all infertility, pressure, RPL are mainly occur with submucous fibroid. Due to heaviness, it leads to chronic abdominal pain, and if it grow gradually increase in the size, it leads to abdominal enlargement. Sometimes patient comes to you with प्रेगनेंसी है एमेनोरिया बिकॉज ऑफ एज फैक्टर की वजह से उसे हो गया होता है, और दे प्रेजेंट एज ए 9 month uterus, and when you feel and when you go for ultrasound you find that it's a fibroid. कई केसेस में ऐसा होता है. इन पेरिफेरल विलेजेस this kind of cases are happened. They believe that they have the pregnancy, but it's actually a fibroid. Life threatening, certain cases of the central fibroid where fibroid is in the endometrial cavity leads to persistent menorrhagia, torrential bleeding, metrorrhagia, and leads to severe anemia. Due to sometimes infection in it leads to severe peritonitis and the septicemia, and rarely carcinomatous changes can happen that leads to sarcoma. Investigation, USG ultrasound is the gold standard diagnostic tool. The USG picture shows the central fibroid, the whole endometrial cavity filled with fibroid. So sometimes it is required to differentiate from adenomyosis. Adenomyosis may be same picture milega, but how to differentiate between adenomyosis and fibroid? Because adenomyosis may there is a diffuse foci hoge. So it leads to the bulky uterus and heterogeneous structure in the myometrium. Well, fibroid is localized, so एक ही जगह enlargement होगा, and mostly fibroid have the capsule, so clear cut demarcation is there. Whereas in adenomyosis there is no such type of clear cut demarcation. So always there is a differential diagnosis have to put between fibroid and adenomyosis. MRI is one another tool for differentiation. Treatment, medical management, always as I told you 75% are asymptomatic. Only we have to think if it causes the symptoms. Actually the surgical criteria is if it is less than 5 centimeter, nothing to do. More than 5 centimeter, have to do. Again, less than 5 centimeter but cause the severe symptoms like if it leads to infertility, leads to RPL, then it has to be removed. Otherwise, no need to remove it. So main treatment is symptomatic. Minimize the blood loss, NSAIDs, mefenamic acid with Trenexa with ethamsilate or Trenexa with mefenamic you can give. LNG-IUS, Mirena also can helps to reduce the blood loss, but the indication is that uterus size should be less than 12 week. कई बार ब्लीडिंग होता है रहता है और पेशेंट को हिस्टेरेक्टमी नहीं करानी है और यूट्रस की साइज इतनी बड़ी नहीं है, इट शुड बी लेस देन 12 वीक्स. सो इन सच केस दिस LNG IUS ऑल्सो हेल्पफुल. न्यूअर ड्रग में मीफेप्रिस्टोन आया है. मीफेप्रिस्टोन द ड्रग दैट यू आर यूजिंग फॉर MTP पिल. MTP पिल में जो मीफेप्रिस्टोन आती है वो 200 मिलीग्राम होती है, सिंगल टैबलेट देते हो आप. यहाँ पे मीफेप्रिस्टोन 25 मिलीग्राम डेली फॉर 3 months followed by 10 milligram daily for another 3 months helps to reduce the size of the fibroid. This is the newer modality of treatment, but I had tried in my 5 to 6 patient, but frankly I am speaking, I had not सेटिस्फाइड विद द रिजल्ट. सपोज 4 सेंटीमीटर का फाइब्रोड है तो 3 सेंटीमीटर हुआ है, उससे ज्यादा कोई इतना फर्क नहीं पड़ा है. इट्स अ न्यूअर ट्रीटमेंट